Imagine a child being judged before they even speak, or simply because they were born with a visible difference. For many families, a cleft lip or a cleft palate is more than a medical condition. It can affect feeding, speech, hearing, confidence, and emotional well-being. Yet, with early diagnosis, surgery, and the right support, children born with a cleft lip or palate can go on to live healthy, fulfilling lives. Unfortunately, myths, stigma, and misinformation still exist, causing some families to delay seeking treatment or to suffer in silence. As July marks Cleft Lip and Palate Awareness Month, tonight we ask, how can we improve awareness, encourage early intervention, and create a more inclusive society for those born with cleft lip and palate? I'm your host, Ilke Platt. Welcome to TUPOPYENI, and we'll be right back after this short break.
This July, during Cleft Lip and Palate Awareness Month, TUPOPYENI explores the realities behind cleft lip and palate. Hear from experts as they debunk common myths, answer your questions, and explain why early diagnosis and treatment can change a child's life.
And before we start today's discussion, let's take a look at the short insert showcasing what we are talking about for today. Indeed, such beautiful children that we saw. And for tonight's discussion, we've invited the experts themselves to give us an overview, some guidance, and to share some light. For that reason, on my immediate right, I'm joined by Dr. Susan Kruger, specialist reconstructive surgeon. Doc, welcome to the show. Thank you for joining us.
Thanks a lot.
No stranger to the hot seat, Dr. Eunice Gonzo. Thank you for always joining us, giving us a psychologist background.
Thank you for having me again.
You're welcome. Dr. Berger, beautiful children that we just saw right now, motherhood, fatherhood, parenting is such a joy. It's such a pleasure. I think just to place things in perspective, what is it that we're speaking of, and how is cleft lip or palate developed? And maybe, you know, some of the developing symptoms.
Okay, good evening. A cleft lip, to start with, can either be just a small little notch in the lip, or a complete cleft right through running up into the nose. The thing is, it can also be just on one side, it can be on both sides, and then there are a lot of other combinations, like, for instance, you can have a cleft lip all in its own, or an isolated cleft lip. Then you can have a cleft lip with a cleft palate. So a cleft palate is basically a split right in the roof of the mouth. Both a cleft lip and palate is congenital defects. It happens very early in pregnancy. The development of the lip is usually between 4 and 6 weeks in the embryo, so it's very early. The development of the palate is anything between 8 and 12 weeks. So it happens very early in pregnancy.
Very, very early. And
very,
that's
very
when
early.
Parents are also notified during that time.
No, you won't pick it up.
Okay.
Not so early. You only pick it up on maybe if they have the sonar done at a later stage of pregnancy. But many of these cases are not even being picked up. Not in Namibia, because we haven't got all the, up north, they don't even have sonar equipment to pick it up. So it's only picked up at birth.
Doc, we just said that, bringing an angel to this earth it's such a joy. And sometimes it's very difficult, number one, to understand what this is of your child, especially firstborn. Number two, to accept it. As first-time parents, what kind of effect does this have on a couple hearing such news?
Especially like what Dr. Kruger was saying, that, when you are going through a pregnancy, it's an expectation. And you go through different types of tests, but not having tests that can pick up on that, it means that by the time that you actually give birth, now everyone, when you are expecting a baby, you are expecting a bouncy, beautiful baby, you understand? So you've got a certain perception or an expectation when it comes to how your baby is going to look like. Now, you can imagine that when you now get a baby and then you look in the child's face, there's a lot of shock a lot of emotional experiences that a mother or the parents might go through by just viewing the child. Now, like Dr. Kruger said, that it comes in different ways. So it means like in some of the pictures that was actually being shown, you can see that especially when it's on both sides. So sometimes it's really, it's quite severe. So, and it might come as like a shock to most parents, which immediately can ignite feelings of grief when it comes to parents, because then already there's feelings of shame. What would people say? What is it that I might have done as a parent that could have led to my child looking like this? So you find it can also trigger, because I remember the other time they were also speaking about depression and so on. So in some parents, it can actually trigger depression, or it can trigger, postnatal depression, with cases that when I was even finding out, even with the NAMFAM Foundation, that at times it can even lead to parents actually rejecting the child because of the way the child is looking.
Yeah, and luckily for tonight, we're going to unpack how to deal with it, giving those tips, giving those, words of encouragement too. Doc, it comes to this time where you tell the news to the parents, okay, fine, your child is diagnosed with this. When doctor mentioned, am I to blame as the parent? What causes this? Is it genetic? Is it something that the parent did? Is it something that, happened wrong during pregnancy? But what causes this?
There are quite a few things that can cause a cleft lip and palate. It may be genetic. So if one of the parents had a defect like that, the incidence of having a child with it is much bigger. Even if they have one sibling with already a cleft lip or a palate, the incidence is much higher. Then a very important factor is nutrition. So mothers, you have to have zinc in your diet. You have to have folic acid in your diet. And we know a lot of our people, especially in the north, don't have access to all the food types that contain those elements.
So dietary is very important.
Yes.
During pregnancy.
During pregnancy, and one of the other reasons is alcohol abuse and smoking, especially in the early times of development of the baby.
And all of these are preventative, Doc?
Yeah, most of it is, yes. Yeah. But if you look all over the world, the incidence of it in Africa is about 1 in 1,000 births. In Asia, it is much higher. It is up to 1 in 700 births, and they don't really know what is the exact cause.
Yeah.
But there are factors that can influence it.
Dr. Gonzo, we always think about the emotional well-being, not only just, with the parents, but even when the children grow up. I mean, then they realize, their identity, how they look like when they start going to school, it becomes worse. Where's that starting conversation from parent to child, all in all, with my son, my daughter? You are unique and different in your own way, but how to deal with that and to parent through that news?
Yeah. I think that, what makes the cleft lip of cleft palate a big problem is that, again, we must, like Dr. Kruger would maybe even explain more about that, is that at times there are those ones who are also born and they don't have a cleft lip, but they've got a cleft palate. Now, that becomes also a problem that at times you'll only find out about that when the child, especially when it comes to the feeding of the child, that the child then the food is coming through the nose, or the child speech is just there's a problem with it. So basically, you find the biggest issue there is, you see, it's one thing for a child to be diagnosed with something, and it's another thing for you to be able to inform the parent what is wrong, but most importantly is, can this be helped? Because that, I think that is usually what gives you the biggest comfort. You know, like looking at those pictures and looking at the wonderful jobs that Dr. Kruger and the rest of the groups, the rest of the team has been doing, it's amazing that despite how the defect is what you are going to inform the parent. Because most of these children, if they get the help, and I think that maybe Dr. Kruger can come in there, I think that maybe it's usually the first operation could be maybe by 18 months or so, or when is the first one? Because you find when they are very young and they are toddlers, the child yet is not aware that they are different, you know, because they are still very young. Now, the problem comes with the children who are older or get help only at a later stage, because they didn't get the information early enough, and it's only later, and the child has started to actually understand that I'm actually different from the other children because of the way people will stare at us. Because the way we learn to understand whether we are different is how people react to us. It's like people become our mirror. It becomes like they are the ones who tells us, am I okay or am I not okay? And that is usually what happens at the early stage of a child. So when people are now staring, looking at the child funny, then the child starts learning that and to internalize that something is quite wrong with my face. And that is usually, and you know how it is, sometimes people are not even aware how they are doing that. And so it is important that when does this child, and this is why awareness is key, if we can do this early enough, then you find that some of the psychological repercussions that we are going to unpack here that will come about would actually could have been prevented.
Yeah, and maybe let's dive into that question, Doc. What can be done from a reconstructive point of view? Surgery-wise, what are some of the advantages? What are some of the disadvantages? Some parents could be given options. Would you like to do a surgery? Would you like to continue just, you know, let the child live as is? But what are those options? And especially with the modern type of technology that we have today, what are some of those solutions?
Okay, we actually have a treatment plan, and we try to explain it to the parents as early as possible so that they know what is the way forward. We usually repair the lip. The most important thing is just to repair the lip. Repair the lip, either at the age we prefer to do it, anything between 3 and 6 months, or if the baby is around 5 kilos. It is just because of the risk of anesthesia. So anything between 3 and 6 months, we repair the lip. Then at about the age of anything between 12 and 18 months, we repair the palate. The reason for that is that the palate is very important in speech. So the earlier you do it, the better. But before the age of about 12 months, it's actually technically very difficult because it's a very small opening. But we want to prepare the palate before the baby starts what we call babbling. So it is usually at around the age of 18 months. Yeah. We get a lot of patients at a much later stage because, as you said, some parents try to hide the kids. Others are not being picked up. Others don't know that there is a treatment plan. Then the other thing is we involve the speech therapist as from a very early age, around, as I say, about 18 months to 2 years, to help the kids, because if the problem with the palate is they've got like nasal speech, so the sound is coming out through their nose, and it is sometimes very difficult to understand them. So it is a problem when they go to school. It is difficult to understand them. Then the next step is, especially in the kids with a cleft palate, there is also a cleft in what we call the alveolus, that is the upper part of the maxilla. So there is a problem with the teeth, with the eruption of the teeth, especially if they have a full palate. So then they need orthodontic treatment. And the orthodontics usually start at around, depends on if it is available, and that is a problem here, at around the age of 10 to 12. So then they need orthodontic treatments. Further, they need bone grafts, also at about the age of 12. And then if there is any other things, other reconstructive procedures, like especially rhinoplasties, because with the cleft lip, you also get quite a defect of the nose. They call it a cleft lip nose. It is very obvious because the cartilages are abnormal. So that is usually done at about around when they're fully grown, like 18.
Yeah.
So it's actually a treatment, a lifetime treatment plan.
And it sounds pretty costly, Doc.
It
I mean,
is.
Doc, you mentioned, you know, some regions don't have these facilities. Not everybody's privileged to even have medical aid. I'm just saying for those that want to do something for their child but can't afford to do that. Our health sector at the moment, do we have facilities everywhere? And how costly is such an exercise, let alone emotional support?
That is where we are very glad for the help of NAMFARM Foundation.
Right.
They sponsor these kids. They have funds available. So we do it in the private sector. They visit clinics. They visit the regions. And that is why it's important to have the awareness month, especially so that people know that there is help. So we do about, I would say, anything between 35 to 40 kids per year. The cost of just a cleft lip repair is about, I would say, about between 25 and 30,000. And a palate repair takes much longer. It's technically much more difficult procedure. So I think that, and they stay in the hospital much longer. So that is about, I would say, about between 40 to 45,000 per case.
Let's focus on the social support. Doc, it's now the Awareness Month in July. Firstly, do you feel, Doc, that many people know about this, number one? Is enough being done and said about this specific, cause? And number three, how can we as Namibians, or even those abroad, support? How can we stop being part of the stereotype, especially those onlookers, how to understand that these children need our support as complete strangers too?
Especially when I was listening to Dr. Kruger, I think the first thing that we should actually do is to try to get ourselves into a mother and as well as the child's life. We all know that the thing that can deplete you emotionally, because it's one thing to repair a tissue, but it's another thing to actually repair psychological wounds. Now, with most of these emotional wounds, one is not able to see it. Now, you find that the biggest problem with the cleft lip or cleft palate is the fact that it actually, most of these procedures are actually happening at the stage of a child where identity development is actually taking place. Now, it means that, right, and with some of these children, especially understanding the severity of it, meaning the way you speak. So at times we can repair the cleft lip, and at times it will look like everything seems to be okay, but still the way that you speak, and some children, your hearing is also affected. So which means that everything that you are doing, right, you are constantly with what healthcare professionals. You are in and out of hospitals. There are procedures being done. Now, there is also parents who are supposed to be with you. Now, these are the same type of parents who are also supposed to be working. And at times, you are not the only child within that same family. So, are we doing enough? We are so grateful for NAMFARM Foundation for actually being able to put in place the whole medical experts to do this. But obviously, because this problem, like if we are talking about 30 to 40 children, that is now the ones that we are seeing. How many others are maybe even hidden, and they are actually going to grow up disfigured because we don't bring the information through. Yes, we are on TV, we are doing awareness, but if we have to be honest, the biggest awareness is usually where at the grassroots, like with languages that people can understand. Are we doing enough on the radios? Basically visiting every maternity or antenatal clinic, and to basically speak about a lot of this, because most people aren't aware about this. And what is worse is the psychological impact that is actually happening when it comes to these families. Families are breaking up. Children are growing up with a low self-esteem, low self-confidence. Some of them will start acting out in class because they are being bullied and they are being teased in class. So, and then most times they might also be missing important times to be with their peers and to get the necessary education. So it means it's a support system that it's not only about the hospital staff, it actually trickles down to the schools. How much are they aware about that? How do we support these children when they are in hospitals to ensure that they are at the same stage as the other children? So if you now look at that, right, do we have enough counselors in all these regions? Is our mental health system able to actually take this in? Especially considering that Namibia only has two psychiatric two psychiatric hospitals in the whole country. So it means that, right, with such a problem, and to ensure that this can be our future leaders, because there's nothing wrong with them, it's just what they are going through, it means that there's still a lot that needs to be done.
Great. We have to go for a quick break, and after this, we'll still continue with that as well. And we'll also open up the phone lines in a bit, but for now, we'll be right back. Stay with us.
This July, during Cleft Lip and Palate Awareness Month, TUPOPYENI explores the realities behind cleft lip and palate. Hear from experts as they debunk common myths, answer your questions, and explain why early diagnosis and treatment can change a child's life.
Okay, we still got a minute break. You can drink some water. Hold on, you'll stand by my seat. Great, we'll open up the phone lines, treatment journey. And then I think let's also, I liked what Doctor mentioned, just as some of the challenge that we still go through, maybe from a
This July, during Cleft Lip and Palate Awareness Month, TUPOPYENI explores the realities behind cleft lip and palate. Hear from experts as they debunk common myths, answer your questions, and explain why early diagnosis and treatment can change a child's life.
Welcome back, and if you just joined us, it's all about the discussion around cleft lip and cleft palate, and we're joined by the experts just to shed more light. If you have a story to tell, if you would like to contribute, if you'd like to ask some questions, please feel free. The telephone lines are now open. That's the number 061-291-3417, 061-291-3417, and please, you can pose it as briefly as possible. Doc, coming back to the follow-up, what more can be done? The challenges in especially the health sector. I mean, Doc works there every day. So what are some of those challenges that we face?
I think the biggest problem at the moment is that there are not enough people on board. You need people, people to visit the clinics, you need people to visit as you said, the maternity wards. We need people to help us with the surgery and anesthesia. We really need some more people on board. That is one of our biggest problems at the moment.
Yeah.
We haven't got enough hands to do all the cases.
Great. And also from that compliment, and we can't always say the physical things because things are always emotion as well. What still lacks? Do we have support groups, Doc? Do we have, parent groups that come together? Do we have that culture of standing by each other? Because many times they say, even if you share your problem, it feels like it's half already. Or are we still in silos because of maybe feeling ashamed, not wanting to share our stories with our families?
Yeah, I think that's a very important question because speaking to NAMFAM Foundation, I know that they've been working tirelessly because even for one to be able to go there and to have the support groups, because they also do work with the Ministry of Health, some with the social workers, and they also have even approached myself to be able to have support groups for the children and for their parents, and to try and to strengthen their coping mechanism, to be able to build up that, to boost that self-esteem, to find out where other children actually still are struggling, So, but again, like I said, we cannot overemphasize that it is usually the bigger the group, because this is quite a lot of children. So you would need a lot more helpers around and a lot more people to join, because the biggest problem here is that people don't quite understand what this is all about. And also, a lot of people don't know what the journey entails, and they don't, because when it comes to support groups, okay, the government is also trying to do, like ensuring that they get a social grant from this time to that time to help the parents. But we all know that even that grant would never be enough for everything that needs to be done, especially when it comes to the psychological needs, because you don't only have to look at the parent, at the child, it's also the parent and other caregivers around. So is enough being done? Again, the question is no, we still need to do more, because the more we can put everything together, then we are going to be able to help as many children as possible, even especially from the psychological perspective.
Yeah.
And I think also we need speech therapists.
Yes.
The problem is if you are like Wambu speaking, you can't have a speech therapist who can only speak English.
Yes.
Language barrier.
It's a big language barrier.
Yeah.
And there are not enough speech therapists around.
Yes. Which is the same thing with therapy. You also find that therapy also is determined. You need people who can speak the different languages.
Yes.
You understand?
Yes.
Because otherwise, otherwise you get a language barrier. So that is another very important part. And we must also not we also have another problem where we also might have to involve even traditional authorities and so on. Why? Because some of these things is also attributed where people think that either it is witchcraft, you understand? Or that,
So it's a cultural thing.
yes, that some people would think that it's witchcraft, some people would think that someone is doing someone and it's a spiritual attack and a lot of other things. So there are certain things that is why education becomes very key, because at the end of the day, again, we've got those divisions that starts occurring within families.
Yeah.
Why? Because a child is looking different from the rest of the other children. So that is where the rejection comes in. That is where the child eventually start having a lot of self-abjection and just really not liking what they see in the mirror. Again, remember, it's a world of appearance.
Yeah, no, it is. Doc, I want to speak about success stories.
Yes.
Let's bring up the happy stories. Like, have there been surgeries where you've seen a family come very depressed and said, Doc, can you please just do your magic by God's grace? Tell us these success stories. What have you done so far? You've been in this for over 2 decades, Doc. How has that journey been, and what makes you happy at the end of the day once you've performed a successful surgery?
Carol is always telling me that I don't see the parents after the surgery, but we do see them. And the mothers and the fathers are so happy. But the one thing is, you see a child going into theatre with a cleft, and they came out with a different face.
Wow.
Some of them are so overwhelmed with either tears or laughing or a lot of emotions, but it makes a big difference. I mean, you don't recognize your own child.
Yeah, complete makeover.
Yes, it's a complete makeover. But I want to tell you something.
Yes, please, Doc. Go ahead.
I have been with Operation Smile for many years. It is also a worldwide organization where we go to different countries to treat cleft lip and palate patients. And I was in Rwanda 1 year, and on my list I had an old man, he was 82, and 2 elderly women. The one was like in his 70s, and the other one was about 65, all with only cleft lips.
All of them?
All 3 of them.
Okay.
And it has never been repaired before. He was in his 80s. So first we said, no, the ladies must go in. And they said, no, they want to see Opa first. we must repair his lip. So we repaired his lip. And when he came out, he was smiling so much, and he was telling them that he can get another wife now. And only then did they decide that they are going to come in.
They're next.
They're next. So
that's a good success story.
Nice success story.
Even for the old. So, and that's another question. Doctor, you said, as early as possible. So it is possible for the older?
Yes, everything is possible.
Generation, yes. If they haven't prior.
If they have, yes.
Okay.
Yes, and we do see them.
Yeah.
They've been walking around like that for many years. I did a patient a while ago. We repaired the lip of the baby, a patient from Angola. We repaired the lip of the baby when the baby was about 6 months old. But the father had a bilateral lip, an incomplete lip, but you could see the like notches on both sides. And he said the baby must come first, and then about a month ago he came back and he said, okay, now it's time for his surgery.
Yeah.
So we did it.
Wow, those are the good, stories that we like to share on public platforms so that other parents can know that it is possible to have, a genuine, good, healthy life from there onwards. But I mean, Doctor, you see parents coming into your room, and the stories are sad. If you were to speak to someone this evening that probably is going through this right now, what are those 3 tips that you can give them? What kind of things that they can do practically for them as parents to help them go through this a little bit easier?
I think for me, what is extremely important is that the first thing to give someone is, I like what you said, stories of hope. It's basically to first of all tell them what is wrong with the child. And then to tell them that it can be helped, it can be solved. Show them the different types of pictures of other children who have gone through that. Yeah. And then thirdly, to tell you that you've got this support system. Basically, I understand the emotions. It's when someone can understand, when you can actually sit and touch someone's soul and say, I do understand what you are going through. I understand the pressure you are going through. I understand the fear and the shame and all these negative emotions. But we are here for you, and we will be able to help you with it. So that is the main 3 things. I would actually tell the parent.
Yeah. Doctor, going forward with, the counseling sessions and the reconstructive surgery, are there some disadvantages? Are there, some of the realities by going through some of the surgeries, not trying to scare, but also being realistic with the pros and the cons? And have you gone through a few of those experiences?
I don't think there's any negatives.
Yeah.
There are some complications once in a while. And it is especially with the palates where they get, if the palate is very wide and the defect is very wide, it is sometimes very difficult to get the two sides together. So what happens is they develop what we call a fistula. So it is still a small opening, and it is usually at the junction of the hard or the soft palate or right in front. So, yeah, they still have then a small opening there where the food comes through. But that is about one of the biggest problems with the palate repair.
Yeah.
The lip repair is straightforward and there are no negatives about it.
And from a technical point of view, is this a long process? Is it very invasive? The recovery period afterwards, maybe let's dwell more into the medical aspect for someone recovering from it.
For the cleft, for a lip repair, the healing time is very quick. It's about a week. I mean,
Wow.
it heals within a week. The palate's a bit more technically difficult. So the baby with a cleft lip can eat and drink immediately after surgery. There's no problem. They can breastfeed. With a palate repair, we usually put them on a fluid diet for at least a week because the stitch line is right in the middle of the palate and you don't want them especially not to suck on a bottle because then the stitches open up. We don't give them any milk products for the first at least a week. So no milk, no yogurt, give them a soft diet. And healing is about 2 weeks.
Okay. And then also from it's a lifelong conditioning that they're living with. Are there medicines that they're put on in terms of just, not even recovery, but just continuing with the treatment? Are there treatment plans involved?
No, not really. For the lip, it is just normal scar management.
Yeah.
The mother can just massage it with a little bit of Vaseline.
Okay.
And that's about it.
Great stuff. So there are so many aspects that we can focus around this specific discussion as well, Dr. Eunice. But are there any of those, speech therapy? What do you go through? Maybe from the more technical point of view, how is that being done?
I think with the speech therapy, because also with what you will find that, right, with a child with maybe a cleft lip or cleft palate, is that there's also what in psychology what we call a speech disorder. So, which unfortunately at times can also be triggered by that, but it would now be due to a medical condition. And this is now the time that we do also ourselves. We will refer to a speech therapist who's going to take the child through by teaching them how to speak, you understand, and how to pronounce things. And like Dr. Kruger was speaking about that nasal thing. And usually children in school would now make fun of that, the speech. And so at times with speech therapy, you would see that there would still always be the difference in speech compared to a normal child with no speech issues. So there would be always something that will tell. So that something, and this is maybe what we are talking about, the psychological scars that grows with you after what, so it's not just about the visible scar, it can be that. Now let us say if your hearing is also affected, you do know that even when you have a hearing issue, there's a certain way that you speak. The speech would also be affected, So, and these are the things that usually play themselves out, especially where in the classroom situation. And this is where, and most of the scars actually develop because of bullying. And that is now why it is extremely important to educate, because a lot of people will always say children will say things, but a lot of adults we are seeing today who are wounded, it is because it emanated from what? From classroom. So it becomes extremely important for our schools to also have a zero tolerance when it comes to bullying. Now remember, even in Namibia, we've got a very high suicide rate, that now we've got even smaller children committing suicide. So I'm not saying that that's what could happen, God forbid, but I'm just saying that it is extremely important that we should be able to teach our children also not to be able to speak negatively to children who did not choose to look the way they are looking. It was not a choice. And like Dr. Kruger also said, it's also the fact that no one really know what is causing it, you know. It's it can also be genetic. So it's not necessarily to put blame on the mother or on someone, but it's for us to move into a space where we are going to be there and to ensure that the child is not bullied at school.
And it seems like a bigger conversation with different role players, from the Ministry of Education
Yes.
to the health sector, to the public, to the, the private sector. What are some of the ways, doctor, that everybody can come to the table? And let's look at corporates. Are corporates also doing enough? Yes, they always say charity starts at home. Start with yourself. But Doc has seen them come and go. I mean, it's been so long that you've been doing the same thing over and over again. But some way, somehow, there should have been an aha moment for Doc to say, if only corporates, or if only, our own households could do that, what would that be, Doc? I'm putting you on the spot.
Yes, you are.
And I know you've thought about it, Doc.
No, I just think we need a lot more of donations from the corporate world. I really think so. There are quite a few on board that I know of, but I think we can do better.
Yeah. And then, Dr. Gonzo, you've traveled the world. You've seen how different countries, go through this, deal with it in terms of the health sector, hospitals, make it a bit more child-friendly. What are some of those notes that you can compare, maybe through observation, since you deal with such of these consultations on a daily basis?
Yes, because what you find that, right, it's actually very important what it is that we are teaching the child. It's basically, for me, is that it's life beyond a scar. You understand? And the conversations that we are having with our children, because some parents don't even want to tell their children why they have that scar. They don't speak about it. It's still something to be ashamed of. And when the child asks, because they feel uncomfortable about it, then they don't want to address it. They want to change the topic. So my thing is, I'm going, what I've learned, what helps everyone, is not the question, what is wrong with someone? Is basically for us to be able to say that I am here, I can hear you, and to be able to tell them that, right, it's okay. Because I always say this in every session that I do, because I do the healing sessions, and I always say that, what is it that if someone breaks a leg, we don't tell them to snap out of it. We tell them go to the hospital and get it fixed. Now here we are talking about, right, the child has a cleft palate, or they have that, they got a cleft lip. So we are not going to put it under the carpet. We are going to tell them that this is what is happening. This is also, we also make the child part of the treatment plan, you understand? And we educate the child themselves about it.
Yes.
So the child is no longer ashamed, because we must teach children that appearance is not everything, that there are actually other greater important attributes to a person, which is love, kindness, careness. And there are so many things we should actually instill within the children. But what I have learned is that despite whatever trials and tribulation a person has gone through, and the moment you are able to heal that mental wound, you'll be amazed that some of these children are our greatest actors, our greatest, they become the next presidents, our teachers, our scientists. So this is why I said, so in therapy, over this, I've been in this profession for over 2 decades right now. So what I've learned is just that when you can see the wound, not the scar, but when you go deeper than the scar and you speak to that, you find a total mind transformation is the aha moment.
Oh yeah, Doc, and I see your face lighting up when you say that, and that's exactly why we're here tonight.
Yes.
You know, to give that aha moment this evening. More on a technical side, Doc, I keep on coming from a very lighter kind of a moment to the serious discussions for parents that have a child with a cleft.
Yeah.
The second born. How likely is it for the second born to also have it as well? What are the chances?
They don't actually know.
Yeah.
There is a higher incidence, but it is not as if you can say it is 20% or 50% or 100%. It's totally unknown.
Okay. All right. But some of the parents, they still continue to at least have a sibling
Yes,
with the next.
yes.
And they're perfectly normal
Yes.
as well.
Yes.
Great, great. For siblings amongst each other in the households, how can children also, be respectful to their elder or their, younger one? For the children specifically, Dr. Gonzo, how should children learn how to behave in the household? Even with us as parents, with normal, even with children in the house, they also tease each other. So how can sibling to siblings also get a word or two, Doc? We're addressing the whole family this evening.
Because I'm looking at that because it's true. Huh? Most times we concentrate on schools, we concentrate
Yes.
on society, and we forget actually the family system itself. I think that when Dr. Kruger touched on we don't know, which means that when you are the parent would obviously also go through a lot of stress when it now comes to the second pregnancy
child,
because
of
now you are
course.
afraid. And at times I have seen families where actually both children have a cleft lip or a cleft palate, but maybe just different in severity, so it can happen again. That's all what I'm saying. So now, imagine when you are born and all the other children are normal and you are the only one who's different. So at times you find if you are when a household is loving, the foundation is of love. And when it comes to, especially when the child has a secure attachment between the mother and the child, there's a very secure one. You will be very shocked that a child who's different but is so loved at home never actually even is aware that they are different because they like I remember when I started, I said we are our faces are the first mirror that a child see to understand whether I'm accepted or whether I'm going to be rejected. Now, when you reject the child, insecure attachment, and the rest of the family, because the children will also mimic what the parents are doing. So what then the other children will start doing is to bullying. But if you, the parent, sit down, explain it, and I think that if you start by your own household, then you find that, right, this child would never feel any different. And the other children actually would be now the soldiers around this child, making sure that if you even try anything, they will come for you. So I think that education always starts at home. If we make sure that as a parent, have a secure attachment, deal with your own emotional issues, and then be able to be there for the child with everything, because the child is going through a lot, him or herself. So if you are the one to be there, then it will be very important for you to be well, and then you make sure that everyone else will be well. So it starts at home.
Oh, no, it does. It does. Charity starts at home.
Yes.
And it's just that safe haven, that safe space. You have to let them know they're the most beautiful child that there is,
Yes.
made in God's image. Doc, as we, land the discussion for this evening, some information that's still very vital for someone to know about before we conclude this evening's discussion.
Well, I think the most important thing is that parents with a kid like this must know that there is a way out. We are there to treat them. We are there to help them.
Short and sweet?
Short and sweet. So I must just contact Nam Farm Foundation.
Great, great. Thank you so much, Doc.
I think as a concluding remark is basically is to teach a child to be that you are more than a scar, that you are more than an appearance, and it really what you look outside actually is really not what determines who you are as a person, what is going to happen in future, and what you are going to become. So what is important is if families can learn to actually instill within their children self-love, the ability to love yourself because you are uniquely you. You know, so that scar makes you uniquely you. You have a story that no other person have. Even when you have gone through the same things, your story is always uniquely yours. And that makes you an extremely special child. So, and I think that if we can just cultivate that for the child to realize that my identity is bigger than a scar, my identity is bigger than appearance, then, and for a child to actually harness the qualities of love, of a sound mind, the qualities of a self-acceptance, irrespective of your physical imperfections, because there's no one who's really perfect, but you are also perfect in your own imperfections. And that is basically the beauty that I want to live with every parent or someone who's living with this, who does not even know about NAMFAM Foundation, is basically for them to realize that there is help. You know, and this can change for you. There are amazing professionals who are all working together to ensure that you are perfectly perfect in your own imperfections.
That's the way to wrap it up. I think for everyone watching this evening, to the two doctors, we appreciate your time, your patience, your love, your care, and above all, just restoring hope. And that's exactly what we needed for this evening. Thank you once again.
Thank you.
There you have it. It's all about just bringing to light those very important discussions for this evening. They say a cleft lip or a palate is not a life sentence, nor should it define a person's future. With timely medical care, emotional support, and an informed community, children born with these conditions can thrive just like any other child. Perhaps the greatest change begins not in the operating theater, but how we respond with understanding instead of judgment and with support instead of stigma. So there you have it. It's all about just educating the public for this evening. Please do take note that the program will repeat later on this evening at midnight, tomorrow, Wednesday at 9 a.m., NBC 1, 9, and 2100 hours. NBC 2 and Saturday morning at 7 a.m. Please don't forget the radio edition. That's Wednesday evenings, 2000 hours, National FM 92.6. With that mouthful, for myself, Ilke, Platt, and the whole TUPOPYENI team, thank you for watching. Until next time, take care of yourself and take care of each other. Good night.